says connected.
Hmm?
It says they're connected, and I hate using the other ones. They're just so much, they're so uncomfortable compared to these.
Right.
Good morning, everyone. We're going to start here in just a couple minutes. For those that asked about the game code, that has been fixed. It was just not enabled. So everything is up and ready for y'all to put that code in so that you can get your points.
You don't have to deal with it. I mean, what do? I bitch about it, let it go to fucking work. I mean, I don't.
Right.
That's all you can do. And
Good morning, everyone. I have 9:15, so we'll go ahead and get things going. This morning for our COVID update, we have Marcella Stark from HUD with us, as well as a couple of her coworker friends that are going to help with the Q&A. So I'm not going to waste any more time. I'm going to turn things over to Marcella. Thank you for joining us this morning.
Good morning, everyone. It's so good to see so many of you on the video this morning. Let me see if I can get the presentation up here for everyone. And we will just get started. Anita Bierman and I actually worked on this presentation for this meeting today, but unfortunately Anita's under the weather, so she wasn't able to join us, which is kind of why I invited Doug and Anita along, or Doug and Joyce along, to help with some Q&As if we get some at the end here. Somebody just give me a shout out. Can you see the screen?
Yes.
Okay, very good. So we'll get started. Anita and I made this intentionally short in nature because we only had, I thought, about 40 minutes on our presentation here. So we wanted to leave plenty of time for questions and answers. But we did put a little something together to talk about the COVID-19 pandemic because, I mean, my gosh, we haven't talked about it at all in the past 7 months, have we? So just to get us going here, we're going to start off with a little bit about the CARES Act. And what the CARES Act is. It, of course, is the relief and security stimulus bill that passed back in March That March 26, 2020 date is very important. The CARES Act provided a lot of different flexibilities and monies, but most importantly for our current programs here, it provided over 1.25 billion to the HCV program and over 685 million to public housing to prevent, prepare for, and respond to the coronavirus pandemic. It created a number of flexibilities in the way our operations happen, from granting waivers to help PHAs minimize some hardships. It also included, as I mentioned before, a lot of money that can be used for a lot of different reasons, additional program needs, and then to give you some extra money to help for the safety of PHAs and the residents. So first, I just want to touch briefly on the waivers and flexibilities. There's a whole list here, as you can probably see on the left-hand side of your screen, separated by program. It would take hours to days to go through these individually, but they are all in an updated notice now that came out in early July 2nd, and the notice is 2020-13. It does detail all the waivers. PHAs are not required to use any of the waivers. They are provided to you to give you some relief in some due dates or some flexibilities in way things are being done because of the pandemic. The one part that I do want to draw your attention to on the waivers, because this is a really, really long notice. It's many, many pages. I don't even know, but over 70 pages worth of notice here. So the notice does detail out each of the waivers in text and paragraphs, but then at the back of the notice, it does provide tables. Tables then are separated by program, the ones that apply to both housing choice voucher and public housing. Then it's separated out by housing choice voucher and then public housing. But the cool thing about the table is it did leave blank spots to talk about so that you could record the dates that you choose to use the waivers on and have the record keeping right there. So if HUD ever comes down and wants to look at your waivers or asks as part of a compliance review or anything in the future, you can just simply pull that table out and say, I know it's been 3 years, but yes, we did use this waiver. Here's my documentation on that. So that was the purpose of the chart. Now moving on to some of the funding. PHAs should use your CARES Act funds to address potential needs in any of the following areas: operations, strategy, distancing, communication, and resource coordination. And we're going to go, the next several slides, we're going to go through and give kind of examples and talk about some things. But first, the timeline. I hope you guys all got copies of the presentation, because if you did, we provided here a list of the notices and kind of what area they had to do with and the dates they became effective. The big ones are, of course, the April 10th, 2020 05, which then, as I mentioned, was superseded by 2020-13 in July. Also, the funding notices are listed there for HCV and public housing, as well as a nice typo there for September 14th, 2020 about the CARES Act extensions, which we will also touch on here in just a second. Another set of resources we provided you, we tried to get a lot of links here to help having them in one place. We know in our office, we were kind of struggling with this bit of information was located here, this bit was located there. So Anita worked real hard to try to get all of the links together so that you could have that. So if you have any questions on those, just let us know. And as far as some deadlines to remember, some of these, the future deadlines, though they're all future deadlines, but could be subject to change. But as they stand right now, we do have a HCV shortfall funding deadline for December 31st. We do have some HAP funding if you receive that for PUC increases, per unit cost increases. That's set to expire June 30th. We also have the mainstream funding, and then the expenditure of the supplemental operating subsidy and the HCV administrative fees that are all due to expire December 31st, 2021. And please note that these were extended. Initially, the use of the CARES Act and the HAP funds was supposed to be done by December 31st, 2020, but they have been extended to 2021 now. So here's just some funding notes, things to know. Again, the expenses are only, CARES Act money can only be used on expenses that incurred after March 27th, 2020, which was the date of the signature of the CARES Act. No double dipping. So if you have FEMA funds to be used for a purchase, you can also use CARES funds for those. Funds cannot be used to pay salaries of local healthcare workers or to pay for medicines. These funds can be used to maintain normal operations. So anything that you would normally spend your operating funds on, you can use CARES Act funds for that too. You can use CARES Act funds for more things, which we're going to get into in just a little bit. They have expanded uses, but normal operations can also be used for the CARES Act funds. The next two are probably the biggest notes about the CARES Act funds. You can only draw down the money to be used for an immediate need. So that usually means if you have a bill that is due, then you can draw the funds down to pay for that bill. That kind of operates like the capital fund program in that way. And then if the funds are not used by December 2021, they would have to be returned to HUD. So now we're going to look at some eligible activities. Please keep in mind, like I said before, and I'll say it again, you can use these funds for any regular operating expenses, but you can also use them for additional expenses that you normally wouldn't be able to use operating funds for, with the purpose to prepare for, protect, and respond to and prevent the coronavirus. So first, under prepare, we just have some ideas here. Those can be spent on office improvements to enable distance interactions, or enhancements to software, equipment to support telework, distancing, Zoom meetings. You can use this money to help with childcare for both your residents and your staff. You can use it for the cost of delivering goods, supplies, and equipment, testing, and administration costs for those who may have to pay overtime. If you had to pay overtime, for example, if some of your maintenance staff ended up quarantined, but others had to work overtime to compensate, you can use the money for that. To prevent coronavirus, it can be used for PPE for pretty much anybody, for your staff, for the offices, physical equipment in the offices, and for your residents. It can be used for COVID testing costs, delivering of supplies for if you had to shelter in place, transporting residents for testing or other preventive health measures, food delivery and or preparation, but ironically, not the actual food. To respond, you can use the money to care for residents and staff who have tested positive, but do not require hospitalization. Public housing units for quarantine use. It says purchase them, but I think that would be kind of odd. But you never know, it may happen somewhere. Technology needs to help children, school-age children who are schooling from home, additional operating costs, internet and devices to support telehealth or education. And now there are just a few things that you can't spend the money on. Anything that happened before March 27th, 2020, the money cannot be spent on. Or anything that will happen after the deadline, which is currently December 31st, 2021. Again, with the food, can't buy food, but you can help pay for food preparation or delivery. Can't even buy a voucher for food. And probably the one thing our HCV PHAs need the most, you cannot use it to help with utility deposits. So that is, here's some more examples. Again, just examples. We've mentioned most of these. Installation of workstations, Zoom, Teams, upgrade the phone system so you can call remotely and check voicemails, purchases of cell phones, Wi-Fi spots, remote trainings, anything, especially for your offices that can be used to promote telework in case we are locked down or stay-at-home orders, things like that again. So with that, that is pretty much all we had prepared for you. It was just kind of a quick overview. But like I said before, we'll be happy to entertain questions, answers, specific instances, case studies, whatever you've got for us. So just let me know.
I have a question, Marcella.
Hi.
Hi. So the CARES money can be used for utility deposits. What about for a Section 8 client and a security deposit?
I'm gonna probably say no on that as well. I don't know if Doug or Joyce has anything to say on it, but it's pretty much anything that you would normally use the money for, and then expected uses to prepare for, prevent, or respond to. With them not doing utility deposits, it makes me think that they normally probably wouldn't want security deposits either.
Okay, thank you.
We will,
I
I
agree
can,
with that. I agree with that. I don't think you should use it for security deposits for Section 8 because now you're talking Section 8 money. If you had the Section 8 voucher, that's only administrative fees, and I don't think that's an allowable usage for the Section 8 CARES funding. This is Doug too, by the way.
Thank you.
good to see you, Patty.
Marcella, this is Carol. There's been a lot of discussion among agencies about hazard pay, different ways that people have approached that. Can you guys kind of walk us, because we've had a lot of agencies do different things. Can you kind of give us a template of what would be permissible for staff?
Probably the reason PHA's ways is because it is permissible in a lot of different ways. You know, they did allow hazard pay for use of the CARES Act. They have allowed overtime. The only way I would be a little more cautious with it, and I'm sure Doug will pop in on this too, is paying a bonus to your employees. You can call it hazard pay, but just a bonus for the sake of working through the pandemic or whatever. That gets because there's so many of the rules on bonuses that need to be tied to performance. That gets a little bit more in a gray area. But it's particularly flexible so that you can do with your PHAs what you need to do. The biggest thing to remember is from 2 CFR 200, necessary and reasonable. So keep it reasonable.
And I would just say this, you know, bonuses are bonuses. Hazard pay is if you're for overtime and you're having to go into units to help clean if, you know, there's, it's kind of like combat duty hazard pay. If you go into a combat area, you're going to receive a higher salary because you're putting yourself at risk type thing. But whatever you do, and I cannot stress this enough, and you've been told this and told this and told this, document of all CARES funding. Set it aside. Keep a special folder of all of your CARES funding aside from your regular financial statements that you give to your fee accountant or whatever. Document thoroughly, detailed, because in 5 years, when HUD comes out, like the R funds, it says, oh, we want to look at this. You can't have CARES funding. You need to have it documented and detailed exactly what those funds are for. It will save you a bunch of work and a bunch of a headache come 5 years when this happens. And you know, I don't have a crystal ball. I'm just going on what happened with the R funds. You've all been through it. And if you haven't been through it, talk to somebody that was here at that time. Document, detailed documents. Can't stress it enough.
Yeah, we've
My
actually had
soapbox.
Yeah, hey, Doug. We've actually had a few PHAs that are scared to use the CARES fund because they said, "Oh, I remember ARA. I'd just rather give it back." And I kind of came to HUD on the tail end of the ARA. I don't want to say fiasco, but ARA issues. So I don't know a whole lot about what happened during ARA, but I'm trying to. That's why we're trying to leave these concerns up front. If you have your documentation, then even if in a couple of years we're forced to go out and review it and things, at least you'll have it close by. And this should be a little easier than ARA, since there are so many more uses for the money as well as operating expenses. So, I've told PHAs before that they could, you can take your salaries out of it, anything from March 27th. So, spend all of that out for salaries, keep the payroll documentation that it came out for salaries, keep that in a file, and then move on from there. But again, it's flexible for the PHAs to use the money for what they need it for.
Come on, I know
Any-
this group. It can't be that quiet. Somebody's got to
Quiet
ask a
group.
question.
I have a feeling it wouldn't be the all in the room together.
I know Harold has to have a question or two. He's writing notes, so yeah.
Okay, I'll ask this question, and I know it's a crystal ball. Maybe Doug has his crystal ball this morning. Is it possible that there'll be an extension on the December 31st date, or have you guys heard?
Anything's
haven't-
possible.
True.
Yeah.
Quite honestly, I think that will all depend on November 5th.
Okay.
Oh, God.
Okay. I mean, we don't know. We don't know what administration is going to be in the office after November 3rd. So November 5th, we probably still won't know. But I think that is going to, there's no way to tell. There's a lot of scenarios that could play out with the upcoming election, and that is going to affect a lot of things. And I think extensions and stuff, me personally, I think that will, could be, a lot of questions until then, until a couple weeks from now.
Okay.
Yeah, and a lot of it, I think, and again, as far as HUD goes, no, we have no indication on whether they'll be extended, but will there be more stimulus, more money, more extensions? I think at this point it's impossible to know. But
Right.
The only thing I know, and I'll give you a sneak peek on that, is something, because we just got this in our email to review. So it appears that something is going to be coming out about the waivers not too long. I don't know if it's an extension, because it literally popped in my email 5 minutes before this Zoom, so I haven't read it yet. But whatever it is, it's not for public dissemination. So, but there may be something coming out regards to the waivers in the next little bit.
I have a question on the Family Self-Sufficiency Professional Coordinating Committee. I did not see any waivers for that. But we're not going to get a committee that's willing to get together in person. And I know not everybody has family self-sufficiency, so it's very specific to me.
Right. While there may not have been anything specific to that, there was several things in here about meetings and public notices and public meetings and Zoom meetings that would, I think, be logical that it would translate over to that particular program.
Okay.
I can submit, I will submit, because HUD does have an email address for waiver questions. So I will, what was the name of that program? It was FSS.
Yeah, family self-sufficiency.
Yeah, but you said something about coordinating or council
Oh,
or something like that.
professional coordinating committee. I mean, it's the same, I mean, we have the same issue with the resident advisory board for section 8. We're trying to my clients aren't going to be Zoom capable. So how do I meet that annual requirement and hold a resident advisory board meeting?
Okay. I will send that up to our COVID FAQ line and see what they have to say on that. And if we get an answer, I'll ensure that Sandy sends it out to everyone on our.
Thank you.
Thank you.
Good morning. This is Darren Taylor down here in Poplar Bluff. I had a question.
Sure.
We recently had our third-party contractor come in and do our UPCS inspections of our residents as required for housing authorities. We are in the middle of a hot spot here in Poplar Bluff, Butler County, where we're seeing COVID cases increasing 20 and 30 cases daily. My situation here is that I've had 4 residents in our elderly, designated elderly high-rise buildings pass away from COVID-19. When our REAC inspection came up, our UPCS inspection, our annual inspections that the housing authorities have to do, I sent out a notice to our residents because it was inspecting our elderly units and giving them the option to opt out of that inspection. Now, I know that housing authorities are required to do those inspections, and I know that REACT is reinstating their inspection process as well with some restrictions if there's a hot spot in the area. But my question is, I was not, and I guess it's a statement, I was not going to have my residents exposed or feel that threatened by an inspection process that we're required to do. So I gave them the opportunity to opt out, and we did have about 80 residents out of 289 units decide that they did not want our third-party contractor in their unit doing those inspections. So I think that's a problem that not only with REACT looking at reinstating the inspection process, but then also for housing authorities doing the UPCS required annual inspections. So I don't know if I have a statement here or a question here, but this pandemic is far from over. And when you have residents that are dying from COVID-19 and are in fear, quite frankly, for their lives, I don't know that some of these things that we're required to do, UPS inspections, UPSCS inspections, annual plan hearings, public hearings, those kinds of things, those things need to be waived, and HUD should consider waiving those things indefinitely. Just wanted to get that out there.
I know there's a lot. Number one, I think it's going to be a long time before any average PHA in Missouri, I'm just going to say it that way. Maybe some of your bigger guys might, but that any average PHA in Missouri is going to see a REAC inspection. They're starting off with multifamily, and then they're going to be targeting PHAs that had lower inspections in the first place. So for most of you guys, I think it's going to be a while before REAC gets to you, and that's a good thing. I too find it odd that they didn't waive the annual inspections for the public housing authorities. That I find that very odd, but keep in mind, there's also no rule that the annual inspection has to be conducted by a third party. It just has to be conducted. So if your maintenance staff has made it into units or goes into a unit to fix something, they could also do the inspection at the same time they're there. So I realize most of the time you guys do the third party thing because they're very good about detailing the deficiencies to get them fixed before REACT comes. But especially without REACT coming for a while, if you want to kind of scale back those annual inspections, you can do that too. Like I said, have your maintenance do it when they go in to change furnace filters, with the pest control people, something like that. I always tell my son this, but to get the check mark that it was done. And then hopefully if the pandemic does lighten up here and people are feeling more safe, or we get the vaccine or any number of things that could over the next year that will hopefully alleviate some of these issues, then you could go back in with your third party.
I hear what you're saying. I appreciate that. And we will figure out a way to get those units inspected because it's a requirement on us to do that. But it's just, I just don't understand the thinking that we're going to be in a position that we're going to be required to potentially expose our residents to a virus that could harm their health and even quite frankly just kill them, to be honest about it. So I appreciate that. I just hope that the higher ups in HUD would give that some further thought until this pandemic is behind us. Thank you.
I agree, Dan. Also keep in mind your residents don't have to be there when you're inspecting too, to minimize the contact. If that helps, they could leave or what. But that's pretty much all from here that I have to kind of help with that situation. But we will, as we are asked about the pandemic, and provide feedback on up and I'll send that comment as well when I send an email up to the COVID FAQs with the FSS question and the Section 8 Resident Advisory Board meeting question.
Well, doesn't the PH12 Public Housing Agency's annual self-inspections on the waiver page 15 cover the annual inspections?
Was that 20? Again, it's impossible.
PH12 Public Housing Agency annual self-inspections. It's a waiver for us to not have to do them. Page 15 of that chart.
Of 05 or of 13?
13. It waives the requirement of the PHA to have to inspect each project.
Michael, could you say that again?
It's the PH12 waiver. It's called Public Housing Agency Annual Self-Inspection. It waives us from having to do those inspections.
What page was that on?
Page 15 of the chart.
Oh, 15 of the chart, page 30 and the notice in the.
Could you repeat the notice number again?
PH12. It's the waiver number, not the notice. It's the 2013. The PIH, whatever it is, 2013 notice, but it's the PH12 item, statutory waiver.
Well, they must have snuck that one in there on me. I didn't see it.
That will cover your annual inspections.
It sure does.
And I'm so sorry. I know that's on public housing, but I know on Section 8, there was a similar waiver where we did not have to do them, but they had to be done by the end of the year.
No, you have until a year from the effective date. That second waiver gives you a year from the effective date, as long as it's before December 31st of this year.
But you're still having to play catch up.
You have to play catch up, but you have another year.
It also gives flexibilities in the waiver that's quite similar for public housing. That was quite similar to HCV about using remote inspections, electronic means, virtual inspections, things like that. That would help also with completing the inspection, but not having contact with residents.
We did the virtual inspections from April through July, and then we started back to physical inspections.
Michael, are you on a biannual, like do you do your inspections every 2 years?
Every 2 years.
So how would I implement that suddenly then?
You can
have
change
to-
your admin plan because you have a waiver on your admin plan for your posting and your public hearing.
And so I don't have to do a public hearing, and I could turn every inspection into a 2-year
But you
inspection.
still need to notify the tenants of the change by just sending out the summary page of what you changed on the admin plan. So if
Okay,
it's changing from annual to biannual, send that out to all your vouchers.
all right, that's what we debated on doing, to work around trying to play catch up on, every inspection you postpone, then you're doubling your inspections every month when you do finally start to catch them up.
I had a no interim policy for Section 8 for any increases of income. And when COVID hit, that killed me. My HAP cost went sky high because I couldn't implement the increases on the unemployment between the annuals. So I changed my admin plan effective June. So I used the waiver to give me that ability.
One thing to note about this public housing annual agency inspections, I mean, he's completely right. It does waive them. I missed that somewhere and I apologize for that. But that availability period, at least, has not yet been extended, and it does only go through the end of this year. To me, that's the most confusing thing about this notice, besides the fact, obviously, you miss things in it when you read it, is every waiver has a little bit different of a due date.
Well, somehow that needs to be extended into next year too. I mean, all of our residents that are elderly and disabled are already under a lot of high anxiety and angst with mental health issues on this stuff. And they're used to having they want our maintenance guy to come in and change their filters we've got it now every 3rd month. We used to do it every month. COVID came out, then we moved it to every 2nd, and now we're doing it every 90 days. So they're glad to see him come in. He's going to do the inspections then. But when we had our UPCS inspector come, they literally were calling the police, and they were calling the mayor, the city council. Their anxieties just shot through the roof, and it wasn't good for them. I mean, they're freaked out enough. So to have this extended, what do we need to do? Do we need to, what do we need to do to get that extended?
I would email the PIH HUD and let them know that that's one you need. They're the policy guys who are working on it. As I said before, we do have some more waiver information, I think, coming, because we got a draft notice this morning. Haven't looked at it, so I don't know what's involved in it, but hopefully that will start addressing some of these issues. Hopefully there's some good stuff in there too.
And I didn't, I wasn't ticked off or, that they did contact the police or the mayor. I felt sorry for them. They were literally going out of their minds on this stuff. So that's just my comment.
Thanks, Bob.
Marcella, as far as you know, not to change the subject from inspections, but on reporting, I saw that quarterly reporting may start towards the end of this month, but I don't see it happening. So do you anticipate really our reporting will happen when we submit our financials?
Probably. We had several questions specifically to the HCV program. Throw that out there for everybody, because I know we've got a mixed group in here, but specifically to the HCV, we had several questions come up last week about reporting because of the VMS deadline, how you would report those expenditures into VMS. And we sent it to the FMC, and they came straight back and said, hold up, we're not ready yet. There's guidance being developed. We'll get it out to everybody when it's ready. So definitely, obviously, it's not going to happen this month because you've already put in your VMS. Maybe by next month's VMS, they'll have something out.